Okay, so my name is Hugo-Ben Horn and I've been playing rugby ever since I can remember. The first big injury I had was in school. I was chasing after a ball and I was running forward. Someone was coming to me and he stepped and I had to change direction quickly, but I was going forward full speed, and when I stopped and I stepped on my left foot and I wanted to go that side, I just felt an enormous pain on the outside of my knee.
I'm Himal Gajjar. I'm a radiologist at SCP Radiology. We see a vast range of acute injuries in various sports. It's such a big topic. Rugby is a very popular sport, and obviously a sport we all follow with passion, and we see a lot of acute rugby injuries. In terms of those groups of injuries, head injuries such as a concussion is a common injury. That is not often imaged, so a mild concussion is normally treated clinically, but if there is a severe concussion or atypical findings, then imaging is indicated, and that will usually be with a CT scan. That is the fastest and most accessible imaging modality, and we're looking for hemorrhage or bleeding on the brain. That can be in the brain tissue or around the brain. We make sure that there is no brain swelling and also ensure that there are no skull fractures. In terms of the other acute injuries, next most frequent are lower limb injuries, followed by upper limb, and lastly chest, so sternal and rib injuries, and followed by abdominal wall or abdominal muscular injuries. So the imaging modality that is chosen usually depends on what the injury is and what the clinician suspects. So for example, in an acute bony injury, such as a shoulder dislocation or a clavicle fracture, an X-ray is an excellent tool and maybe the only imaging that is needed in that scenario. If there are more complex bony injuries, or a bony injury is suspected and not seen on an X-ray, then a CT scan is an excellent tool to look at the bones. But it is not a great tool to look at the soft tissues. And if a soft tissue injury is suspected, then either ultrasound or MRI is appropriate. Obviously, an ultrasound can only see what is accessible. So it is an excellent tool where something is superficial or accessible. But if the injury is deep, for example, within the knee joint, like an ACL tear, unfortunately, the bony structures obscure the sound beam. So there one would do an MRI. So one really tailors the imaging that is done dependent on the injury you suspect.